Alright, hey guys, it's November 8th of 2011, and today I want to talk a little bit about Transhealth, because yesterday was my first appointment after having started testosterone. So, the doctor that I go to is thankfully somewhat trans knowledgeable. She's not she hasn't had a lot of trans patients, and I don't think she's ever had a female an F10. But I gotta give her credit because she at least knows what transgenderism is, and sorry, and she gets the concept, and she doesn't quite get all the medical stuff that goes along with taking care of somebody who's transgender, but that's just one of those experience things. So here we go. But she's really nice and really tries very hard to take the knowledge that she has with working with. Sorry, there's just a car doing something weird outside. But she tries to take the knowledge that she has of testosterone therapy and female and male anatomy and kind of mushing it into this huge bra. So, you know, but she tries really hard, and and I like her. So here we go. So yesterday was my first health appointment after I've started testosterone. And I have to say that scheduling it in November was, especially for my first appointment, was probably the worst idea that I could have done, or that I could have had, because not only am I walking in with body hair, in odd places, and my legs look like, woolly mammoths, and, all this pit hair and chest hair and belly hair and everything else, but I'm also walking in, which I know it doesn't seem like it could make it much worse, but it does, is the facial hair from No Shave November, which I'm actually getting quite a bit. I know you can't see it because of stupid lighting, but I'm doing update videos, so at the end of the month I'll just put them all together. But I'm getting it all down here and all down here and all up here, and my sideburns are coming in, and it's just coming in everywhere, and it's coming in dark. It's not even blonde, but it's starting to come in dark. So I just felt really self-conscious, every now and then I get this thing God, I'm just, this, my male identity and my trans male identity, just kind of goes out the window every now and then. I'm just God, because of all this damn dysphoria that I have going on still in a lot of ways. And at times the testosterone makes it so much better, but at times it makes it so much worse. And this especially was one of those times where it was just made far, far worse. And I had to get, because she had to check, whether they're, the breasticles were okay and everything. One of the things we talked about was, she went over, my hormone dosage and who was prescribing it, and, everything, and it's nice that she acknowledged that, because I was expecting her to kind of gloss over, who's doing my testosterone, because she doesn't have anything to do with it, but, she is my PCP, so, I guess I could understand that. So we went over that, and then she asked me about my menstrual cycle, or lack thereof, and I told her I haven't had a period in 9 months. I haven't bled in 9 months, which is great. So then but she said, within the midst of discussing that, she wanted to schedule me for an ultrasound, because to make sure that my uterine lining wasn't building up to the point where it could potentially cause problems. And she said that if I go get the ultrasound and it does, it is thinking that she's going to want to induce a period every 3 months, and, which I don't want to do, and that just gives me more money and more incentive to save up to get a histo at some point in time soon. But, I'm not exactly sure, I'm really nervous about that, because the cheapest place to get one would be going through my hospital, would be to use my hospital. But again, like I've said in a previous video, my HR is connected, my HR my place of employment, it's all kind of connected, and I'm like, I don't want to. I'm like, the last thing I honestly want to do is go to a place that I work with people that I may end up seeing uh, by transporting a patient, or just by generally seeing them around the hospital, and have them know, and potentially say something. And I know HIPAA's in place, and I know all those great laws are in place for a reason. However, something always leaks, always. So I'm just really nervous, and it could be, and it's not even, and it could be something where they say, oh well, I knew because I saw the chest, I didn't, and whatever, and there's no Adam's apple or lack of facial hair or something, something. It could always be passed off on something else. So I'm sort of nervous about even just getting the ultrasound in general. Because, I mean, really, everybody around where I work, and, knows me as a male. So, you go in and say, yeah, I need an ultrasound of my ovaries. I just don't want to deal with that. So, we'll see about, I'm going to see about getting it somewhere else. But that's my initial, like, oh, God reaction. And the reason that I'm not sure if like I even want to deal with that in the first place is because from my understanding, testosterone completely stops it stops the ovaries in general. Like it doesn't like have anything release, and like from what I understand, that whole thing just sort of shuts down. And from my understanding, but this is like back in like 6th grade when I took this stupid health class, was that when the egg is released from the ovary and then that enters the cervix, that's what causes the lining to start to build. And because I don't have an egg releasing, and I don't have anything doing anything, how my uterus could be building up anything is kind of beyond me. And I've also heard that guys have had to have have had to have their uterus like scraped or have had a period induced, like right after they start testosterone, because they were building a lining, and the lining didn't leave the body, but mine did. Like I took the shot, and then I had a period. Like next, like the next couple days, it started, and I had a full blown period. So I don't know how that's gonna work out, but we'll see. The other thing I asked, because I had to have the breasticle exam, she asked me about, or no, actually, I asked her about if I'm going to have to worry about breast cancer after top surgery. Now, I know most of you guys are going, no, your breast tissue is going to be gone. But part of me was like, they remove a lot. But there's always potential. There's always potential for, some small amount to be left behind and cancer to develop. And she said, well, and and I know that men develop breast cancer also, but that's because they have breast tissue and whatever. It's just because of the hormones in biomales that the breasticles don't develop. Hang on, I'm gonna go let my dogs in real quick. Okay, sorry. So I asked about that, and she said that because the prevalent, like I do have breast cancer history in my family, and she said that because there is some, that really doesn't put me over like the general populace percentage. So there is a chance, but not to really worry about it. But that if I wanted to, I could start getting like everything checked out, like when I'm 40 or something. And she said because the person, it was kind of funny because she had to like take my my physiology and kind of separate that from like my age, because the person in my family, which was my aunt who got breast cancer, she was postmenopausal, and she's like, well, you're only 30, so you really don't have to worry about that. And then she's like, well, oh wait, you did kind of have menopause induced on you, so you may want to start getting them early. It was actually just funny to watch. But so, she said that because a lot of the tissue is getting removed, I'm not going to have to worry so much about it. But that if I want to if I want to get checked out, I can do that. And I don't think she was expecting that question coming completely out of left field either. The other thing and the other thing that I want to bring up, because I actually had the courage to ask about this. Um, Now, because of the testosterone, the vaginal lining does get. I mean, it does get thicker, and the speculums hurt. They hurt. Um, so when I actually had like the courage to ask, I asked the doctor, and I asked the medical assistant, Tifa, come here. I asked the medical assistant if they had like a smaller speculum to use, because I was already kind of dreading this. I mean, I didn't like pap smears before, and I was especially dreading this one because things have just been more uncomfortable with that region of my body. So when I asked, they actually did have a smaller size, and they were more than happy to accommodate and let me use that one and whatever. They were actually talking about using the pediatric speculum, which go figure, there is one. But they said they didn't have to use but that one wouldn't allow for something to happen correctly. So, but they did use a smaller one, and it was surprisingly more comfortable. So to Tifa. Teeth. Yeah. So it's kind of one of those things that I just want to throw out there that if you ask, there's a potential for them to accommodate and possibly make you a little more comfortable, and therefore, to go, going and getting a pap may not be quite as bad, because my experience really just physically was actually pretty good in comparison to what I was expecting it to be. Let's see. Another quick thing was that I got my. I just want to point out that I got my. I know I said in my last video that I got my testosterone. I got my needles, and the needles came in fairly quickly. It took about a week to get them, and and they look good, and the quality looks good, and everything like that. So, I would recommend using Tampa Medical Supply if you need to order, a big ass bulk thing of needles. Use them; they're really good. So, I think that's it. I'm gonna yeah, that's it. So, I hope you're all doing good, and I'll talk to y'all soon.